My client is a middle-class African-American male in his mid-30s who is currently married with a 6-month-old son. The client is self-referred for anxiety symptoms he has been experiencing for the past 3 months since taking a new job promotion, and also tensions with his wife. The client was born and raised in Philadelphia in a close-knit family. 2 years ago, the last of his family moved out of state, leaving his wife as his only support system. The client seems well acculturated and shared no family medical or mental health history. The client also did not state any personal medical or mental health history. The client has recently received a job promotion that involves significantly increased responsibilities and workload. Goals for the client are to reduce anxiety symptoms, to reduce tension with his wife and reconnect with her, spend time with his son, and communicate with his boss without losing his job. Faulty cognitions of the client include being a burden on his family, including his wife, parents, and siblings, fear of being fired for bringing up his concerns about his job load, concerns about his son at daycare possibly being hurt. The client expressed concern about things like SIDS, and the client not being able to talk with his wife regarding his job workload. The central theme of the client's anxiety seems to be a fear of rejection if he expresses his needs to those around him. Treatment will involve challenging his faulty cognitions. The 4 things we will address. First, it is highly unlikely that his son will be hurt or harmed at daycare. Daycare is state certified. He has expressed that his son likes it at daycare and they feel confident in the daycare facility. Second, the wife won't hate him for sharing concerns about his workload. Third, the family won't hate him for wanting to talk to them about his concerns and things that trouble him in his life. Fourth, his boss is unlikely to fire him for respectfully sharing his concerns about his workload and the challenges he's facing. We will also challenge and try to extinguish 4 maladaptive behaviors. First, the client expressed that he spends time at work looking at pictures of his son and worrying about what might happen to him. We'll address this by having the client only look at pictures of his son during authorized break periods at work, so he can better focus on his workload. Second, we will have him gradually start to share his concerns about work with his wife. Third, we will have the client call his family out of state at least once every week or 2 to reconnect with them. Fourth, we will have the client practice doing dialogue with his boss about his concerns regarding his workload. We can do this through either having the client videotape himself at home, or in session, we can practice the dialogue. Through these actions, we can hopefully reduce maladaptive behaviors and reduce the client's anxiety level while helping him to reconnect with his wife, his son, and his extended family.